All right, Laura, it looks like our participant numbers have sort of leveled off. So good morning, everyone, and thanks so much for joining us. I am playing the role of Mary Alice Cohen this morning. So you're going to be hearing from me a bit today, but first I'm going to turn it over to Laura to kind of walk us through the draft compilation of recommendations that we have and to give us an opportunity to chat about those before we talk about some next steps and some closing remarks. So Laura, please take it away. Laura, do we still have you with us?
Yes, sorry. I told you I was just complaining about technology and here I am doing it again. Hello. Can you hear me now, Lindley?
Yep, we got you.
Perfect. All right, my apologies for technological snafus. It's amazing to me that a setup one day can work perfectly and the next day goes sideways for no apparent reason. Undoubtedly user error. What we're hoping to do today is, because we are nearing the end, excuse me, of our challenge, of our task, we thought we would go through all of the recommendations and report back to those of you who were unable to participate in the meetings related to the FFN network, and just sort of give you a chance, to provide a last set of feedback. If there's anything else you want to see, any other recommendations you want to see, we can make sure to add those to the ultimate list. And then our next and final meeting will be to review some of the tools that we've developed and provide feedback on those. So for some of you who have attended every single meeting, this may be a bit repetitive because you may have heard it before, but for those of you who've missed meetings, hopefully this will fill in the gaps. And again, it's designed to make sure that everyone, including participants and panelists, if you have any sort of final words and recommendations and thoughts, that you provide those to us so we can include them in the final collection of recommendations. So what I'm inclined to do is read through sort of all of them, and then if folks have questions, excuse me, if folks have questions throughout, please speak up. Or if you have a question and you're a participant, you can put the question into the chat so we can talk as we're going. But my thought is we'll go through all of them and then have a more robust discussion at the end, because there is some overlap. So if that works for folks, we'll get started. Okay, so the first recommendation is a graphic that clearly lists the approved types of unlicensed and exempt care so that all the options are clear. The goal with this is to make sure that it's communicated that all of the kinds of care that are allowable are great, and not to skew language or just the way that they're described for one over the other, to make sure that folks feel that all their choices are valid. Next is there'll be folks would like to see a graphic or other summary for law enforcement that would include signs of safe care, the general outline of the process, explanations of the different types of care, a brief summary of the exemptions in law, some information on how to read a license, and then sort of the why, prepare a training that could be available for first responders that explains the why behind regulations, more for the supervisors. And then for line personnel, we might not spend as much time on the why, and then have that online training module available. There's also a thought that the graphic that outlines the lists of different types of approved care could be available to first responders, so that if they see something, they could pass it out. They could have a handout to provide to people and keep that in their cars. There are some questions about law enforcement specifically, and when I say law enforcement, I apologize, I mean first responders. A question about whether it would be possible to have an email address where first responders could send emails with basic information about a potentially concerning incident. The suggestion was that automation is not necessary. It's not that when you click one button, it goes to all different places, but that it would be easier to have a place that an email could go, because an automation would be difficult given that different first responders use different kinds of software. Then there's some questions, some areas of inquiry participants would like to see in involving first responders, how we can avoid unnecessary scrutiny on permitted care, so that folks who are providing care don't feel as if they're being punished or being sort of attacked in any way. One of the ways that we would consider this is with co-responding on call. So if there were a concern, we could have a first responder as well as someone from licensing or a trusted person from the area, so that folks would feel comfortable. In the first responders, we would focus some of the larger districts and larger areas, because sometimes the larger fire districts and police departments support the smaller ones, but we wouldn't forget the smaller ones either. Considering some changes to the SOPs, again, along this line, childcare rules currently require providers to report when they've had contact with emergency personnel. That's 770152. And when they report, the thought would be perhaps we could include in that recommendation that they, or in that regulation, that they also report the incident number or case report number if they know it, which will allow sort of tracking of all of those things. First responders are interested in sort of any sort of available database that could list folks who are authorized to provide care, and so that needs to be investigated within the current opinions from the Attorney General's office about privacy and information that folks have. Any questions about that so far? Joe?
Thanks for the rundown, Laura. Joe Homlar, a Division of Child Welfare Director at CDHS. Just a quick question. It sounds like this information, although you said first responders and law enforcement, that would be public information for anybody interested as well. Is that correct?
Well, that's a good question. So the current thought is that the graphic would be, the training would be specifically geared towards first responders. So I guess I'm wondering about which piece of information you're talking about. I mean, if folks reported care, then that would go through the standard open records request.
Okay, so the graphic explaining the layout is accompanied by a training. And then I think I heard that law enforcement first responders with access to that information could provide further information, maybe more public facing information, pamphlets and whatnot, to general members of the public if they're interested.
Yes. So the training itself that would be geared towards first responders, I don't know that the current idea is that would be available to other folks, although certainly we could investigate whether it makes sense to do a training for the general public. But the pamphlets and the graphic that explains the different types of care, as well as graphics that we'll discuss in a minute, that would provide information for parents and providers who are looking at either licensed, exempt, family, or childcare centers, exempt, and family homes, questions that they could ask in making a decision about where to place their child. Those things would be available to the general public.
Okay, thanks, Laura. That's very helpful.
Okay. And the interesting thing we had such a great conversation, I think it was at meeting 3, about the existing document that licensing has on Colorado Shines. I believe that's where it lives, about questions to ask a provider when you're considering where to place your child. And we just had great feedback that one size fits all document just is not particularly helpful for families who are looking at exempt care or even family care homes. And that's why the feedback came back that we need one for each of those appropriate and legal and excellent pathways, so that families will have that information no matter which option is best for them. Any other questions on that before I keep going? Okay, seeing none, we'll keep going. Okay. Then the department is going to create a communication plan involving a number of resources, which I'll list for you just because I think it's such ways of safe care and how to choose safe care and how to make information, as well as information for providers about the different
Hey,
kinds
Laura,
of care.
Did,
Yeah,
did everyone else experience this cutoff of Laura, or was that just me? Everyone else, could you start that second or that third communication recommendation again?
sure.
Thanks.
Yeah, and please let me know if that happens again. I appreciate that. So the communication plan would be designed to communicate both with families to support them as they make the decision about what kind of care is best for them, and for providers to help providers understand the different types of permissible care, which would either help them provide exempt care that is truly exempt, or if they're providing care for which a license is required, it would help them come into compliance either by reducing the number of children they care for, or becoming licensed. So the list of folks that we had discussed reaching out to is impressive. I'm proud of everyone for coming up with so many suggestions. Thumbs up if you can still hear me. Good. Okay. Thanks. All right. Libraries, family resource centers, community organizations, refugee and immigrant resources, Colorado statewide parent coalitions, Cultivado Valley Settlement, Integrated Community, the Spring Institute, community colleges and higher education facilities, CPS, teen parenting programs, alternative high schools, church groups, workforce development centers, prevention programs such as Nurse Family Partnership, WIC, other home visitation organizations, PAT, Safe Care, Nurturing Parents, schools, parenting classes, Next Door, TikTok, Instagram, Facebook, Craigslist, YouTube, HOA blogs to try and target neighbors who are often a source of advice for parents, TV spots and local news, OBGYNs, with the thought that perhaps the second month checkup would be a time to introduce the idea of investigating care for expecting parents, pediatricians, emergency personnel, hospitals, birthing classes, doulas, midwives, and birthing centers, mom blogs, dad blogs, Colorado parent blogs. And then there was further thought about perhaps coming up with some sort of SKU or QCR code that could be a sticker that could be given to some of these folks to place on, for example, pregnancy tests or car seats or other places where parents might be able to just, click a smartphone and check and see the information about safe care. Any additional thoughts on those organizations or other places? We'll talk in a minute about crafting the communication plan and what would it include, but any other thoughts about other groups?
Is there a reason why early childhood councils are not on this list?
Nope. It should be. So I guess the answer is probably scribe error, which would be me. I think I saw a question. Can we include the Child Care Association throughout the state and the distributions? Sure, you mean the Early Childhood Education Association, Caroline, or is there a different one that I'm missing? The answer is yes, we can include all of those things. Okay, in crafting the communication plan, go ahead.
was gonna say maybe we could also consider like higher ed institutions, those that have the, well, obviously there's parents in higher ed, and so somehow including this information for new parents in college and those that are utilizing whether it's the on-campus centers and things like that.
Yes, that's great. OBGYN and peds need to bring up childcare prior to the 2-month checkup. There's a huge shortage to families and need to check in and care. Okay, that's great. There is a recommendation coming about asking the department to reach out to the medical care community, and I use that broadly, not to just refer to traditional physicians, to figure out how they can support specifically this effort to encourage, to support safe care in Colorado. And that would both encompass how we can involve them in the communication plan, what kind of information they need, what kind of information they want, number one. And then number two, how the medical community would respond in the face of a tragedy. So a fatality, a near fatality, or an egregious incident. And my understanding is from Mary Alice is that there are funds specifically earmarked for medical professionals in the American Recovery Act. So that'll be able to happen. So that's exciting to know that we have funds to look at that. Okay. So in crafting the communication plan, there are a number of topics that the department will consider addressing, such as a provider's need for a new license should they physically move, just sort of the reminder that a license is tied both to the human being who secured the license and the location where care is provided. That the exemption contemplates 4 or fewer children per exempt home, not 4 children per adult. And then in crafting the language, there will be an intentional focus on not using language that feels like a judgment as to what kind of care a family needs or picks. Awareness that using the phrase sort of education of parents may leave some parents and caregivers feeling as if they're being judged for what they know or don't know. We've had resounding requests for language to be as simple as possible, resisting the need to make things sound legal and make it approachable so that there's a step-by-step. One of the suggestions that came out of our 2 conversations with FFN providers, a meeting we conducted with translation, which caused some hiccups, but was truly it was an excellent experience, was that there be a very simple sort of, here's how you become licensed, to help folks who do want to become licensed but are intimidated by the process, have them understand what's going on. And again, in as simple as possible. The communication plan will be crafted with the understanding that illegal is an inflammatory word as it relates to care. Removal of language such as licensed care is the best care. We will try to assure that the content design are appropriate for areas outside of the larger metro areas. So when we review the initial tools, the hope is that we'll be able to bring in folks from all across Colorado to ensure that that those graphics and that information works for them. And then consider whether there's a way to use kind of the tri-county model and that others used also to dispel myths about vaccines and to shine a light on safe care. So sort of looking to see which, if there's a model out there that we can use to convey that information. The information that's produced will be in a digital printable format for ease of use by other partners so that they can print out as many as they need, as well as some hard copies. We're going to consider creating something for YouTube in a video form. YouTube is one of a very highly searched search engine, so that is a good option. We're going to make sure that the graphic is readable on a phone because of the lack of access to internet or computers in some areas or populations. And then we'll consult and use the early childhood councils early and often, again, in an attempt to make sure that we're communicating with all areas of Colorado in a way that's approachable. The goal will be to have that initial document be more of an information drop, but then there'll be follow-up resources for training sort of needed to change behavior. That would include maybe an elevator speech or conversation guides, similar to what was created for safe storage and substance abuse that I think Jade and others were talking about. And then we'll translate that into multiple languages. Any thoughts on that? See if there are any more questions. Please use the terms nanny and nanny shares in the information. Include that childcare license needed even if the individual has CDE teacher license and caring for more of the child. Great. All right. So then it also included, as I mentioned, also included in the communication plan is what will happen if there's a fatality, a near fatality, or egregious incident. The goal would be to convene relevant parties by phone or Zoom quickly to share information and identify tasks. And that could include, licensing, county officials, human services, first responders, law enforcement, medical, hospitals, and any other state or local agencies or officials who play a role in responding to that tragedy. This was recommended in response to the conversation about the fatality review boards, with the acknowledgement that those happen, a year, 18 months after incidents. And so it would be helpful to have something that is more in the short term to just make sure that there aren't missed opportunities to improve or ways to communicate more efficiently. In the communication plan, as I noted, for moving forward with the American Rescue Plan dollars, there'll be a plan to reach out to medical personnel to determine the best way to support them, again, both in developing a resource for their use, to understand what information they need, take a survey and understand what information they need and what information they want, and then also to address any processes that can be improved as it relates to a fatality, a near fatality, or a critical incident. So then we talked a little bit about updating standard operating procedures that are used by licensing. That would include clarifying for parties outside the department when visits will take place and when cease and desist letters will be delivered. Encouragement to conduct more visits at random times, and particularly at pickup and drop off when parents are going to be present on site. And then investigate whether there's a place that others can send screenshots or other evidence found on social media of unsafe care, perhaps to create a database of sort of, quote, partial information identifying that could be used as additional information is gathered to identify unsafe care. This came in response to folks' frustrations that, ads are seen on Craigslist and things like that, but there's no address. And so the question of how do you respond to concerned care, and how do you identify and then investigate care that is of a concern if you don't have full information? So the idea would be perhaps there's a way to collect, sort of those partial pieces of information so that it will be available when full information is finally identified and we have addresses and names and things like that. There would be inclusion in the standard operating procedures for guidance about how to review Facebook, care.com, Craigslist, HOA websites, Nextdoor, etc. in enforcement efforts where those were identified as places where people advertise unsafe care. And then consider how child care licensing can incentivize safe care. How can licensing encourage folks to provide as well as use safe care? Part of this process would include requesting a legal opinion from the assistant AG about the use of social media in identifying and responding to allegations of safe care, to make sure that folks' constitutional rights and rights to privacy and things like that are not trampled upon, while we continue to move forward with the goal of ensuring that all children in Colorado have safe care. There were some recommendations about clarifying exemptions, about clarifying the language in statute that relates to exemptions, some specific provisions. For example, why does the definition of child care center in 266102 include the phrase, whether the facility is operated with or without compensation for such care and with or without the stated educational purpose, while the definition of family child care home does not. So just some things like that to look at the statute and determine whether there are provisions that could be updated or tweaked so that discussion of all different areas where care is provided is consistent. There's a question about whether the definition of exempt family child care home provider is sufficiently broad and inclusive in light of our discussion about language and the way that that care should be discussed. There was a question about whether statutory language throughout the statutes, both 26, 24, and the child abuse statute, could be clarified so it's consistent using the language of fatality, near fatality, and egregious incident. There was some language or some questions about how we address nanny shares and make it clear that they're not automatically exempt, just a subsection. And then questions about what the statutory difference is between no discernible pattern and occasional care, and whether those two phrases are used deliberately to signify different things, or whether that's just a place where the statute needs to sort of catch up. Are you all thoroughly asleep after that discussion of statutes? There was a question about whether we could use in responding to incidents of fatalities, near fatalities or egregious incidents, whether we could use the CDC SUIDIRF, I don't know how to pronounce that acronym, the Sudden Unexplained Infant Death Investigation Report Form. So sort of looking at resources that are already out there and making sure that we're making the most of them rather than recreating the wheel unnecessarily. Early on, we had a number of conversations when talking about first responders about the limits that face folks who are investigating unsafe care and their ability or inability to enter a home where providers are, where care is being provided. As a result, there was some discussion about how best to use the statute 266112 that provides that a violation of Title I, which is the Child Care Licensing Code, is a misdemeanor. There are fines listed in one section, and then there are not fines listed in another section. And then we have the Ellie Matthews bill that discusses fines. So the recommendation is that that child care licensing requests a legal opinion or obtains clarification, if a legal opinion is not necessary, on how they can use fines to disincentivize unsafe care. This came in part from the discussion points where folks revealed that they believe one of the reasons that folks provide unsafe care, for example, caring for 17 children with one adult in a home without a license, was money. And so the thought is that if fines were levied, that might disincentivize that behavior. There was some discussion about whether the model currently used in statute to assess fines, which involves going to the assistant or going to the administrative law judge, to an ALJ, is the most efficient, or whether the department could adopt a model similar to used by electricians or some of the other regulatory arms of Colorado, which allows for a fine to be levied upfront without going to an ALJ. Any questions about that so far? Anything we're missing? Holes? Okay, then there were some questions about how we can gather information about what local towns and cities are doing. For example, Denver incorporates the child care licensing regulations into their municipal code. So there was a question about whether it would be useful for the state to create an editable, SRP or standard response protocol for local governments to streamline their reporting and communication about unsafe care. That would be perhaps a bit further off, and it might involve some conversations with state and local governments and special districts to see if that's a resource that would be of interest to them. In creating a communication plan, there were questions about whether there was a way to use the system that's already in place for death notifications as a model. Again, with the idea that if we're going to improve the system, we can look at what's already happening and use those models, and rather than create things out of whole cloth. When addressing the systems in place to review facts after a tragedy, one of the recommendations is that the department consider the process review undergone in connection with the maternal as a model for that ongoing process for improvement post-tragedy. Again, trying to use models that already work and see if we can't do that. We talked about co-responders. Then one of the main recommendations, which somehow is on page 5 of these, I'm not sure how, is that there'll be a creation of a unit within the department that would address safe care separate and apart from current licensing specialists. The idea is that licensing specialists have a lot on their plate and they're focused on licensed care. And so having a separate unit that is focused on exempt care and safe care in general would be a more efficient use of time and would ensure that that review and support and enforcement, all those things together, are happening without distraction by other things. I'll go through the names. I see a hand raised. Is that you, Joe?
Yeah, thanks. Yeah, thanks, Laura. Just two things. One, since that's a recommendation that many from this group feel that it's important, perhaps we should pull that out as a separate bullet on this page, because it just gets into safe care enforcement unit. If it's not established in some other place, that might be wise to do. The second thought for the panel is, when the co-responder model is used, perhaps there's a cooperative agreement or memorandum of understanding about how those responses will be followed.
I love the idea of an MOU. The format of this is still rough, so I agree that needs to be pulled out. I'm not sure why it's so low on this list right now. Probably because I was combining two things into one. But that makes perfect sense, and I love the idea of an MOU. Thank you, Joe. So in looking at that unit, we originally called it an enforcement unit and realized that name is sort of limiting and doesn't necessarily encompass all of the duties of that unit. We started brainstorming what it could be called. Some of the suggestions are and we don't have a firm suggestion yet, but just for the purposes of brainstorming, using words like coaching, support unit, safety awareness unit, compliance, observation, child safety support, administrative support, quality assurance, implementation unit, fulfillment, licensing fulfillment, childcare fulfillment unit, Colorado childcare safety unit, childcare safety support, childcare safety and awareness, sustainable unit, safe childcare task force, home childcare support, exempt care enforcement unit, accountability unit, Together We Care for Children or Kids, FFN, safe childcare, child aid, create an acronym. Other people said, we don't like acronyms. So those are just sort of in brainstorming kind of the ideas and thinking about sort of where folks want to go. I think it's nice to think about the kinds of words that would feel approachable to people and language that would not sort of hinder folks' involvement or help them feel like this is more, like this is just an enforcement or sort of aggressive place. Okay, so then we had a very robust conversation. It was so exciting with a number of FFN providers with two main questions. We first questioned the name of the enforcement unit. And then number two, we talked about what happens if the unit identifies providers who need a license but don't have a license. And then if the unit identifies FFN providers who are truly exempt and want to remain exempt, to determine what information and support we could provide them. So looking at the first question, if the unit identifies providers who need a license but don't have one, what steps could be taken? There was some discussion about just sort of what happens when that goes forward. And then what folks asked for was essentially education and resources. Folks suggested that additional conversations with FFN providers to identify what the true barriers were to becoming licensed. Participants would like to see one-on-one help or an apprenticeship or mentoring or coaching, including individuals who speak the languages other than English. They'd like those easy pathway documents to sort of simplify the licensing process. There were a number of requests to consider licensing apartments in addition to sort of freestanding homes. There was a lot of discussion about financial barriers, such as the costs associated with transportation, materials and supplies, the cost of training to become qualified, to update the home and yard for care, so you're getting ready for that, and the cost of coming into compliance with local zoning. There was additional request for developing contacts in the community, as we've discussed before with the communication plan. Folks were interested in having the EQIT course paid for. A lot of really heartfelt testimonials and positive feelings about the PASO training. And then a request that the get ready for licensing training by the department, the request that be publicized more often.
Hey, Laura,
Then, yes, please.
if I could just, I would love to put an asterisk, if we can, by the recommendation of considering apartment complex apartments for licensing. And I think the reason I say that is mostly just because we're seeing, especially in the metro area, so many single family unit homes being torn down from multifamily units. And so we're losing single family homes. And so that means that we are losing more opportunities for licensed family childcare homes. And so if we could just maybe asterisk that to I don't know if everyone agrees or not, but just to like
Sure, I think
drive that
it
point
makes,
home.
Yeah, I think it makes sense to, and I'll reorganize this so it's once we have all the final feedback. But I think it makes sense to call that out as its own bullet point and say, particularly in metro areas where there are fewer single family homes, how we can investigate those options. I think that makes perfect sense.
I have a quick question.
Yes.
Does anyone know the reasoning or the justification for why apartments aren't currently able to be licensed?
Laura, I can answer that. We actually can license apartments currently. The issues that they run into are around they don't have a dedicated separate outdoor play space. And then the other bigger issue that we run into is the emergency exiting and what's required for emergency egress. So those are the two main I guess main stumbling blocks or barriers that we have in licensing apartments. And it is a good time to look at this because we are in the process of reviewing the family child care home regulations right now. And so we can definitely, look at our rules as they're currently regulated and see if there's ways we can remove those barriers. But we have licensed apartments in the past and we still can. It's very difficult because of those two things.
Got it. Thank you, Karen, for that perspective. Any other questions or feedback on that particular point?
This is probably going way out of the scope of the work that we do, but this seems like this is a good bridge of different industries where these recommendations can also be on developers that, when counties and municipalities are giving permits for these new multifamily homes, that they're taking this into consideration. I mean, that to me seems like it's something we need to loop in with municipalities as far as like when they do give that permit. Are they considering the fact that there is adequate emergency escape things and play areas and things like that? You'd think I'd know the language a little better.
You're perfect. So it sounds like we mentioned earlier about providing seeing what cities and towns are doing with respect to safe care and whether they needed a, some sort of standard response protocol or, a form or something, include some language there, because my guess is those hurdles would be in zoning, because that's what the cities and towns would enforce in issuing permits. Does that make sense? So sort of provide some sample language to cities and towns. Consider doing that. Okay. So then the other question that we addressed with FFN providers who are truly exempt and want to remain exempt was sort of what information and support could the unit provide to those providers to make sure that we're supporting exempt care. Again, there was a resounding request for training, for support for work with particular children, such as, mental health consultants, developmental assessments, some economic support. The point was made that no one ever turns down a free CPR and first aid class. That's something that folks really enjoy having access to. Again, a request for a step-by-step explanation on how to become licensed in case those providers decide that's a path they want to go down. Consider whether it would be appropriate for them to have a regulatory waiver or to know how to apply for a regulatory waiver to care for more children. Outreach options for education of FFN providers on topics such as safe sleep, work with trusted folks in the community, social media, Facebook, to deliver information in languages that are easily accessible. There was a lot of questions about supporting children with disabilities and special needs, with the recognition that it's not uncommon for families to choose an FFN provider when they have a child with special needs, because that child can receive more of that individualized care that sometimes parents feel is lacking in larger group settings. The FFN provider said what they don't need is sort of a generalized training on here's how to handle all disabilities, but rather the opportunity to take specific trainings on, autism or Downs or seizure disorders or, just specific disabilities, so that they can sort of brainstorm how to support children with those unique, with those challenges. Educational resources such as books and toys were things that were suggested. I don't know if there's an opportunity there to reach out to, sort of secondhand or sort of co-op kind of organizations, so folks can do that and obtain those things for a lower price. One great point that was made about the educational resources is that oftentimes with FFN providers or family care homes, children will join the care group as infants and then stay until they're older. So those, it's not that the child just moves to a different classroom where there are age appropriate materials. So that one facility needs to be able to cover all ages. And so there was a request for sort of the full spectrum of toys and books and resources. I thought that was a good point. Again, ongoing requests for mental health consultants, some support in physical space challenges and how to set up a space. Because again, if you're dealing with FFN care, it's in a home, you're sort of retrofitting oftentimes for providing care. So how can they make changes to the physical plant that will ensure quality care and learning and safety? The request for any sort of training is that they happen at different times, would be available online, so that folks could take trainings at hours that were convenient for them. There was a request for trainings in person as well as online. So perhaps there's a mixed delivery method option. There was a request for some additional outreach to FFN providers, a survey to informal care providers to ask them what they need and what they want. One of the financial points that was interesting was that because the FFN providers shared that in their minds, folks provided care for more children because they needed the money in order to sustain their operations. So the question was, is there a way for us to support FFN providers so that if they reduce the number of children in care so that they are exempt, that their income is not drastically impacted? There was questions about food support, and then the informal communities, and then the department has backpacks with material. They want to make sure they're trying to get those to the FFN providers. What does that bring up for folks? Anyone who participated in the FFN discussions have any comments about how that process went or where there's room for additional improvement? All right, let's take a look at the chat. Marina says there's a third group we haven't addressed, those who are currently not exempt but don't want to be licensed. How do we support them to become exempt providers? That's sort of what we were trying to get in that last group of folks who want to be exempt. But we can make sure that it's very clear that that's what we're doing. All right, so here's your opportunity. The question here is, what have we missed? What else do we need to address? Are there other things that you heard us speak about that didn't make it into these recommendations that you want to stress before we turn this sort of jumbled list into a more groomed list of recommendations?
I do have a thought where I see community partnerships. Really, it's just on their communication plan. But I think that in order for this to really be effective, that there does need to be intentional community partnerships and investment in community organizations that are on the ground doing this work. With all of these recommendations, from even supporting the whatever unit it becomes named, to the communications, to how do we support providers that want to be licensed to those that don't want to be licensed. And I think that it would be great just to make sure that that's called out in the recommendations, that we're not expecting the department alone to do all of these except for communications.
Okay, that makes perfect sense. Thank you, Lorena. That sounds like a good structural change we could make in communicating the final plan.
I have two thoughts / comments. I think the first one is, I think this graphic around the types of care is going to be really critically important. And I've heard it even like throughout the recommendations and conversation today, the difference between licensed care, exempt, legally exempt care, in-home family child care, FFN care, like there's so many places where those overlap or don't. And so I think just being really intentional and clear on that graphic, what are the differences, what are the pathways, will be really important. And then my other comment is, if I recall correctly, the leading kind of cause of death in many of the fatalities we have is related to unsafe sleep environments or sleep-related deaths. And I know that is sprinkled in a little bit, but I'm wondering if we want to kind of more clearly call that out, as that seems to be a kind of our leading cause of tragedy.
Great idea. I like both of those things, just ensuring, and it'll be interesting to see the feedback when we have the draft graphics to see if that accomplishes your goal, Jade, of really being clear and sort of that Venn diagram of where things overlap and where they don't. So that I think that will be critical to make sure that everyone is able to provide feedback on that. And then I love the idea of highlighting unsafe sleep. Are there other sort of topics or areas like that? I'm thinking of safe storage, or other things like that that we could make sure to list as sort of areas for education and support throughout the document.
Laura, I think it might be beneficial just to have a placeholder and make sure, because a lot of these trainings are free on PDIS to those that can, have internet access and can do that. And they're open to both FFN providers, anybody in the child care community, whether you're providing care with a license or you're an FFN provider, can access those really wonderful trainings. So I think it'd probably be important to highlight that we need to communicate that better to the FFN community as well, that they can take advantage of that information and trainings, and even the families could if they would like to as well. So I think that's one thing we probably don't highlight or communicate enough as a department, that there are some really good trainings available to them.
Thank you, Karen. And are those on PDIS or Colorado Shines? Where do those live? You broke up a little bit.
Yeah,
At least.
they're in the Colorado Shines Professional Development Information System. So they're on PDIS, and that is, they are available to FFN.
And even to families?
Yes.
Excellent.
Yeah, just to piggyback on Karen's point, in the 20 interviews I conducted with FFN providers across the state in May of this year, none of the individuals mentioned PDIS as a support, and none of the individuals I spoke to were aware of PDIS. So I do think that there is work to be done to raise awareness around the existing types of trainings and supports that are available, that are free, that are online for FFN providers. And we need to just be more intentional about connecting FFN providers to opportunities that already exist within the system.
Thank you, Katie. That's useful. It's important to know that message is not being heard. So thank you for that. What other dots aren't we connecting, or other areas that we need to look at? Any of the participants who are not panelists, any thoughts you have, feel free to put them in the chat. Great point, Jade, about conforming the information or making sure the information on PDIS is informative or useful for parents from their perspective. Well, we want to be respectful of people's time. That was our main goal for this meeting, was just to make sure that everyone had the opportunity to kind of interact a bit with the final recommendations. And so if no one, this is your going once, going twice, going 3 times reminder. And we will meet up again as a task force to look at some of the tools that are developed to provide the kind of feedback that folks are addressing now, to make sure that the language that's used in those tools is inclusive and supportive, to make sure that's appealing to folks in all areas of Colorado, and with different backgrounds, supportive of FFN providers, et cetera. So I look forward to hearing your feedback on those tools when we have them. We don't yet have a date, I don't believe, but maybe Lindley, you could touch on our next steps.
Yeah, absolutely, Laura. So as I mentioned at the outset of the meeting, Mary Alice had something emergent come up, so I am representing her on the meeting today. But first and foremost, I really want to just thank all of the task force members and all of the folks who have joined these meetings and the specific breakout meetings that we've had. I think that incredible list of recommendations that Laura just read through is a testament to the amount of work that we've accomplished in really a fairly short amount of time. So thank you very much, everybody, for showing up, for participating, for having these conversations. I think we can see really impactful and measurable change come from that. So as Laura said, next steps. So I kept disclaiming in the chat that the document that Laura read through today, that we worked off of today, was really just the brain dump, if you will, of information and recommendations. We'll put together a more formalized text version of the final report that will also incorporate the feedback from today. And we will open that up to written feedback from our task force members and folks. So if you're familiar, for example, with how we do feedback for like our state plan, it'll be similar to that process. So you'll have an opportunity for that written feedback to make sure things are captured correctly and we're capturing everything that needs to be in there. And then we will design out a final report, and we will also have an implementation plan that goes along with that. So things that can get kicked off right away and start working on. I know my communications team here in the OEC is ready to get pretty busy working on lots of these. And also a plan for how to move forward with things that need some more input. So if they need legal opinion or it would require a rule change, things that are going to take a little more time, they can't really be done overnight, but how do we start moving towards that? So stay tuned. That's what's next. As Laura mentioned, we will gather folks again to review some of these tools, and we'll just keep it fluid in terms of pulling folks together either live or via written or emailed feedback on what we're putting together. But with that, thank you again, everybody, so much for your participation. Laura, do you have anything else before we close? Or any task force members, any closing?
I don't, other than just my only follow-ups would just be to echo that. Thanks everyone so much for all of your contributions and your thoughts and your time. I really appreciate it. I hope you feel like your points of view and your experience have been heard. That's been our goal as we all sort of continue to move forward with the mind of providing safe care for all children in Colorado. All right,
everyone.
thanks everyone. Have a safe and less smoky day.